Hello guys, today we will learn about Wilson's disease. It's a metabolic liver disease which occurs due to mutation in ATP7B gene which is present on chromosome number 13. So it's a hereditary problem. It occurs mainly in age group of 3 to 20 years, but it can also affect in elderly people up to the age of 50 years. The problem of this disease is copper transport. Copper is not get transported in biliary secretions and it's deposited in liver, brain and various other tissues of our body. So the deposited copper leads various signs and symptoms which are like hepatic signs and symptoms. We see anorexia, jaundice, ascites, cirrhosis. When copper deposited in the brain, in basal ganglia part, the patient have movement problems, balance issues. When copper deposited in the eyes, we see Kleser-Fleischer rings and sunflower cataract. We also see other symptoms like psychiatric issues in the patient, and other things are infertility due to miscarriage, hypothyroidism, amenorrhea, arthritis, cardiomyopathy as well. What are the investigations of this disease? These are serum copper estimations which shows decreased copper in the body and decreased serum ceruloplasmin. In this disease, the copper is not incorporated in the ceruloplasmin, so the free copper gets secreted in the urine and we see increased urine copper, increased liver copper, and we also see hemolytic anemia, renal Fanconi syndrome. In molecular testing, we see mutations in ATP7B gene, and other gene can also lead Wilson disease like feature are CAT, SOD2 and MTHER gene. Now come in the treatment part of Wilson's disease. In the very first, we used to give BAL for the treatment of Wilson disease, but with the time we give D-penicillamine because D-penicillamine leads deficiency of vitamin B6, so vitamin B6 is also supplemented along with D-penicillamine. Other options are trientine, tetrathiomolybdate, zinc acetate. Zinc acetate is also useful during the pregnancy and it is associated with very less side effect. When Wilson's disease gets in its advanced stage or metabolic treatment is not sufficient, the last resort we have is liver transplantations. But in modern time we have various other things like gene therapy and methanobactin. In gene therapy, we use adeno-associated virus mediated ATP7B gene and we deliver this gene to hepatocytes. You know When 20% hepatocyte is transformed with this gene, the conditions get improved. So these are the things about Wilson's disease. Thank you.